Our research was rural areas and the need for stroke education. I'm Hailey Godfrey.
And I'm Melodie Penn.
And we're with the Department of Occupational Therapy at Arkansas State University.
To start off with a few statistics to put emphasis on this issue, according to the Centers for Disease Control in 2020, someone in the United States suffers from a stroke every 40 seconds. And Jober et al. In 2008 states stroke is the fourth major cause of disease burden worldwide, equaling 5.7 million stroke deaths in 2005. 80% of these strokes were individuals living in rural areas. For this scoping review, we analyzed the need for occupational therapy to provide education to those at risk of stroke and surviving stroke in rural areas.
For our methodology for this scoping review, we used the PRISMA SCR to guide us during the scoping review process. There were 5 stages to identifying relevant literature, and these were researching databases based on search syntax, analyzing article titles for relevance to the research question, analyzing full text, extracting data from relevant articles, and identifying themes. We included full text, peer-reviewed systematic reviews, questionnaires, and surveys written in English from Sentinel between 2001 and 2020. We did not exclude articles based on the location of publishing. To organize our results, we created a data extraction tool to assist with tracking the number of results and listing relevant articles. The PRISMA diagram located on our poster shows the number of articles yielded, screened, excluded, and total studies included in the review.
We identified 3 themes within our review that we deemed important subjects when addressing this issue. The first is the geographical disadvantage that individuals living in rural areas face. Howard et al. 2017 determined that the risk for strokes in rural areas is 23% higher in larger rural towns and 30% higher in small isolated regions compared to that of urban areas. Our second theme identified was the need for stroke education. The study showed the need for increased awareness of warning signs and risk factors and primary and secondary prevention projects. The type of education needed to reduce the likelihood of stroke for individuals living in rural areas is to increase the stroke knowledge by understanding the signs and symptoms, identifying the risk factors, and creating lifestyle changes. With this being said, it brings us to our third and final theme of how occupational therapy's role can contribute to addressing this need. Occupational therapy is a client-centered health profession concerned with promoting the health and well-being through occupation. The primary goal of occupational therapy is to enable people to participate in the activities of their everyday lives. We do this by working with people and communities to enhance their ability to engage in the occupations they want to do, need to do, and are expected to do, or by modifying the occupation or the environment to better support their occupational engagement.
Strengths of this scoping review include the various methods used to gather information and results, and it shows that occupational therapy is needed to make an impact on this global issue. Occupational therapy is needed to educate and advocate for individuals at risk for stroke in rural areas. Limitations of the scoping review are a majority of the studies included a small sample size, which limited the research findings and the potential to gain knowledge. There is also a need for continued research on this subject and how occupational therapy plays a vital role. We recommend further research on this topic to determine effective methods to providing education and treatment to clients in rural areas. We also recommend the need for increased knowledge and awareness of stroke in rural areas by healthcare professionals. And lastly, we recommend exploration of additional methods to make education accessible to individuals in rural areas.
More access to healthcare is vital to the rural population in prevention of stroke. However, understanding how to best provide this education and access requires further investigation. In reflection on the findings and the literature, the increased prevalence of stroke in rural areas creates a need for education and intervention, in which occupational therapists are trained to promote positive outcomes and well-being for this population. Thank you.